I picked medicine as a career because when I was a kid, I grew up in Baltimore, Maryland, and we used to take field trips to Hopkins from time to time because it was right up the street. And I just found it so fascinating to see how they interacted with the kids and the patients, and I just was something I wanted to do from the time I was probably in 4th or 5th grade. So what I love about general surgery, and the reason I picked that over other things, is that I like the idea of doing something to help a patient, whether it's to take out their appendix that's ruptured or drain an abscess or fix a hernia. It really appeals to me, the time in the OR and the physically doing something to make somebody feel better. I love to see somebody the day after surgery or a couple days after surgery and they tell me, "Doc, you fixed me, I'm so much better." That's clearly the best part of my job. I happen to like trauma quite a bit, and we do cover trauma at Fairview Hospital. That's an emergency situation versus an outpatient situation, but I was on call a couple of Octobers ago when a truck crashed into a bar in Westlake, and I happened to take care of 2 critically injured patients from that, and both of them lived and did quite well afterwards, and I'm very proud of that. Fairview Hospital is a really great place to be for a lot of reasons. It's got a lot of the resources of main campus. We have great physicians of all specialties there in case there are problems taking care of patients either from the ER or post-operatively. And we have a lot of resources in terms of ICU and pharmacy and techs of all kinds. So in that sense, it's a great place to practice because you can do complex surgical cases and know that your patients will be well taken care of. The flip side of that makes it different than main campus is it is a slightly smaller hospital. It's easier to get around, it's easier to park. So it's kind of got the best of both worlds in that sense.